Hi, my name is Jeff Agozzi, and I'm an orthopedic surgeon here at the Pacific Orthopedic Institute in Los Angeles. We're here near the Los Angeles airport. This video is to be a refresher course for those of my patients who have back pain due to a bulging disc. I've instructed my patients that there are three curves of the spine, and the discs which make up the space between the vertebral bodies are like jelly donuts. And when you have low back pain, you usually have at least one jelly donut that has a crack in it, and the crack goes to the back. So if this is a jelly donut, the normal disc has the jelly in the middle, and someone with a painful disc, the jelly goes into a crack going towards the back, either to the middle or to the left or right. And this is what causes their back pain due to a bulging disc. We normally have three curves with good posture of the neck, upper back, and lower back. The T is for the thoracic spine. This area is here to accommodate the heart and lungs, and this is the curve of the lower back. When we sit, have bad posture, stoop, and bend forward, we have one big reverse C curve, and this is what causes pressure by loading the front of this jelly donut, causing more of the jelly to go in the crack and causing more back pain. This is why many of my patients, including myself, who also has back pain, has increased back pain and stiffness after prolonged sitting. Before doing the following exercises, you should be seen by your regular doctor or an orthopedic surgeon to make sure that you don't have other causes of back pain. This is a typical patient with back pain. As you can see, he has this big reverse C curve. He's slouched over. He's loading the front of his bulging disc, causing him to have more back pain. So the first exercise we teach him is the chin in, chest out, butt in exercise. So with his head, he tucks his chin, sticks his chest out, and squeezes his butt together. He does this and holds it here while he's waiting in line, waiting for an elevator, or just standing. And what this does is it strengthens all of his muscles on the back of his spine, including his gluteal muscles, so that he maintains the three normal curves and takes the load off his front of his bulging disc. Many times when you have a bulging disc causing back pain, your hamstrings, that is the muscles behind your legs, get tight, and this will aggravate your back pain. What this causes is your pelvis to rotate. The hamstrings attach on the back of the pelvis and the back of the knee, and what they do is when they're tight, they rotate the pelvis, so now you're in this big C, reverse C position, causing more back pain. So in order to fix this problem, the second exercise is to do hamstring stretching. We're going to do the hamstring stretching in a special way so that we don't flex or bend at the spine. So the patient's going to salute a chair. First of all, he's going to stand like a soldier, salute the chair, put his foot up there, and he's going to bend at the hips and not the spine. That way he's stretching his hamstrings but not hurting his back. And he can actually put his hands in the lower part of his curve to make sure that this is not flattening and maintaining itself. The second part of this is that he can turn his foot out and stretch the outer part of his hamstrings. And why don't you count to 30 and show us how you're doing that. 30 and all the way to the one. And then he goes back after he's finished. He stands like a soldier. And if you're a girl, you can stand like a ballerina. Put your foot up there again. And turn your leg in internally, and he gets the inside part of his hamstrings. Go ahead and count to 30 and slowly stretch. And this should not hurt your back when doing this. You'll feel some tightness and pain in the hamstring area, but you can look at that as though your back pain is leaving you by stretching your hamstrings. And then he'll do the other leg. Go ahead and demonstrate that. Stand like a soldier, rotate your leg out to get the outer hamstring, and count to 30 slowly, and then I'll go back up, turn your leg the other way to get the inner hamstring, standing like a soldier and bending only at the hips. This is a great way of stretching your hamstrings without hurting your back. The final exercise we call the fixer, because this actually pushes the jelly back in the middle of the disc and alleviates your back pain. We again use the 65 centimeter Swiss exercise ball. The key is to get on the floor, put your feet up against the wall or a door, and put the ball up against your femur. Your legs are spread about and your feet up against the wall or door. about shoulder width, and then you're going to push yourself onto the ball, extending your knees, and what we would like you to do is then keep your head and neck down towards and looking towards the floor, and then lifting your shoulders up. And in order to do this properly, you need to count to approximately 150. And what this is doing is you're hyperextending your spine, you're pushing the jelly back into the middle and fixing the broken jelly donut. And at the same time, you're strengthening all of the muscles that are on the back of your spine, as well as your gluteal muscles, so that you're also giving yourself strength, and when you walk and stand, you'll have proper posture after doing this exercise. This should give you immediate relief of your back pain. If you have back pain that's fairly significant, you can do this twice a day, but if for maintenance, you should do this once a day, these set of exercises. The next exercise is a sit-up, and we use a Swiss exercise ball, a 65 centimeter ball, and what this does is it protects the curve of the back. Go ahead and let's demonstrate that. So the ball actually is going in the curve of the back. Make sure you keep your legs spread apart and your knees are about 90 degrees and spread apart so that you got good balance. And what I do is I teach the patients to look where the wall and the ceiling come together so that they keep their head and neck in a neutral position. Go ahead and demonstrate how you do the sit-up. Just go halfway up. And you're not really bending at the spine, you're just coming up. So that you don't curve or flex at the spine to injure your disc. And by putting the ball in the curve of the back, this protects the disc. As you can see, when you sit, this also puts the bulging disc at risk. I find that sitting is the worst thing I can do for my back as well as my patients. And there's an easy solution to this. As you can see, this patient has, again, the big reverse C, which causes the bulging disc to worsen. So what we do is we ask him to move his hips all the way to the back of the chair, and we use a McKenzie lumbar roll, and we put it in the curve of the back and allow him to sit back. What this does is recreates the curve of the lumbar spine and takes the load off the bulging disc and makes the patient feel much more comfortable, and they will not have a lot of back pain when they get up from a chair. Another device that can be used, and I find very effective, is called the Nada chair. This has been around for approximately 18 years. This actually does a great job of supporting the lumbar curve. By putting this on, go ahead and put this around your knees. Put it on properly. This will actually give the lumbar curve much more support, and if you're sitting at a computer all day or do desk work all day, this is very effective. Unfortunately, this cannot be used while driving a car, that is, and therefore you should use a lumbar roll. It clips in the front. We then ask the patient to move forward a little. They pull it a little tight, and then they lean back, and this just gives great support to the lower curve of the spine and alleviates a lot of pain. I can't sit without using a Nada chair myself. So these are the exercises that have helped myself as well as many of my patients. Certainly if these exercises don't help you, you should see your doctor and probably an orthopedic surgeon. If you do have any questions regarding back pain or any orthopedic questions, you can call our office at 310-643-0821 or look at our website at pacificorthopedicinstitute.com. Thank you.